Welcome to Health and Wellness. I'm Sharon Chung, and today with me we have Dr. Shalini Dharan, consultant endocrinologist, and Dr. John Mathen, ophthalmologist from Pantai Hospital, Kuala Lumpur. We will speak about diabetic eye disease, a leading cause of blindness, which often has no early warning signs. Though diabetes increases the risk for a wide variety of health concerns, but vision loss is one of the most common and preventable. Welcome to the show, Dr. Shalini and Dr. John.
Hi, Sharon. Thank you for having me. Thank you to BizTech Asia as well.
Thank you.
Thank you
okay,
so
Dr.
much.
Shalini, maybe I can start off with you. Can you share with us how common is this problem and why is diabetes the leading cause of blindness?
All right, sure, we'll do. As you all know that diabetes is a very common chronic illness in among all the chronic illnesses. Diabetes is one of the leading. As we speak, there's already 363 million people worldwide suffering with this disease. As for Malaysia, we have about 3.9 million of our population living with diabetes. Out of this, about 1/3 of them actually have diabetes eye disease. About around 34.6% of all the diabetes patients have diabetic retinopathy. All right, and this the reason why it's also a leading cause of blindness is because the first few early stages of diabetes retinopathy is usually asymptomatic. Asymptomatic means the patient do not feel anything, they do not suffer any eye symptoms, but yet the complications has already started. All right, okay.
So maybe Dr. John, if the patient is diagnosed with diabetes retinopathy, so will the patient actually eventually go blind?
Well, Sharon, yes. If it depends on, let me just begin by saying there are two types of diabetic retinopathy. There is a non-proliferative and proliferative. So what is the difference? Well, simply put, we have our own grading for it. Initially, it starts off with a few bleeding spots here and there on the retina, and then if left untreated, uncontrolled, and your sugar is not controlled well, this becomes worse, and then this soon will lead to the retina being damaged, and now that will lead to permanent loss of vision. So being a diabetic, you have to come for minimum eye examination at least once a year. Now, the problem with diabetic retinopathy is it's painless. So the patient will not realize that something is going on in the eye until one day you wake up and you say, oh, I've got a bit of blurring of vision, let me go and see what's happening. And then, sometimes they come in a very advanced stage.
Oh, I see. Okay, but what can be done since, there's not much symptoms. And so when the patient actually finds out that they have this problem, so what can actually be done to prolong the sight?
Okay, so from our point of view, and this is even the same advice from the Ministry of Health, is everyone should go for a yearly eye examination. Now, if you don't have diabetes, if everything is fine, maybe even 1 in 2 yearly, but yearly is advised. The day you're diagnosed with diabetes, then for sure, the doctor who has diagnosed you will definitely advise you, among other things, to go for an eye examination, and it is best that you do. Now, let's say maybe along the way, due to some miscommunication, this was not mentioned. The patient should be made aware to come for an eye examination. So at least you have an early examination to see if there's a problem. Has it already started? Is it going to start?
Okay, Dr. Shalini, you were talking about earlier about diabetes, and the types of diabetes. How many types of diabetes are there? And does all types of diabetes actually trigger eye disease?
Yes. All right. So let me just quickly explain about diabetes. So diabetes, mainly there is two types, type 1 and type 2. Type 1 meaning that you are probably insulin depleted. That means, or there is no insulin in the body at all due to autoimmune dysfunction destruction of the pancreatic cells that produces the hormone insulin. And type 2 diabetes is, on the other hand, is a condition of insulin deficiency with the presence of insulin resistance. So in the early stage of type 2 diabetes, usually we can treat the patients with oral medications to improve the insulin release from the pancreas and improve the sensitivity of the body towards this hormone. But eventually, some of those patients may also require some amount of insulin to help them to get a good blood glucose control. All right, so going back to diabetes retinopathy, both type 1 and type 2 are at high risk to develop these complications. And the complication increases with the duration of diabetes, meaning the longer you are living with this illness, diabetes, the higher chance for you to develop diabetes retinopathy. So for type 1 diabetes, as early as 5 years upon diagnosis. As for type 2, because many of our populations, in fact, not only in Malaysia, but throughout the world, they may be not coming with the diagnosis early. You know, sometimes they may be living with type 2 diabetes for a long time before they were ever diagnosed. So, and as just to highlight that most of the symptoms of diabetes are not there with the patient when they actually have the disease. And usually when they present to us, they present late, you know, when the sugars are very high and, you know, it's a bit too late, and sometimes the complication has already set in. So in short, for type 1 diabetes, we usually screen them for diabetic retinopathy 5 years upon diagnosis. But for type 2, which is the majority of the patients of our diabetes are type 2, we screen them upon diagnosis. And like Dr. John mentioned, every year screening is warranted.
I see. Is it a misconception that if you take too much sugar, you know, from young, that you eventually develop diabetes?
Oh, I think it's not a misconception. I think if you are taking a lot of sugar and sugary drinks, carbonated drinks, which is actually very rich in sugar, you probably end up having diabetes earlier than you expect. And just to highlight another fact is that now our type 2 diabetes are presenting at an earlier age rather than, you know, at their 50s or 60s. So we have as young as 10 years old children with type 2 diabetes and not type 1, all right? And this is because of lifestyle and obesity. Right. So
can you actually avoid diabetes if it runs in your family? Is it hereditary or is it genetic?
Right. So let's just talk about type 2 diabetes first. About up to 70 to 80% risk of developing diabetes type 2 if there is a family history. Like example, if either one of your parents are diabetic, that it puts you at higher risk than the people without any family history. At the same time, if both parents are diabetes, the risk is even more higher. Okay, that's one. And if you have a family history of diabetes, what you should do is actually to come forward to be screened earlier than the recommended age, which for general population of above 40 to be screened for this disease. People with a family history should come earlier, as early as in their 20s. Some would recommend as early as the moment the child hits puberty to be screened for diabetes, right? Because we are seeing more and more younger adults getting the diabetes earlier rather than later. And usually those who are diagnosed diabetes earlier, the complications are usually more severe and more aggressive and severe. And therefore sometimes we have to intensively treat them rather than just letting them treat themselves with lifestyle and diet, you know, for these complications.
Dr. John, there's some visuals that I think that you maybe you can elaborate a bit more on.
Sure.
Yeah.
Thanks. I just want to let you all know. Okay, the slide as it's shown here, that is the picture of the eye, and on the side there is the side view. So for our vision to be, for you to see properly, three areas need to be functioning well. The first is the cornea, which is the front part of the eye. That's considered that like the windscreen of the car, and then comes the lens, and then comes the retina. So now diabetes not only affects the retina, it also can affect the anterior parts of the eye. So if we can just go back, Sharon.
Yes.
Okay, right here, this is a problem where it's called recurrent corneal abrasion, whereby the surface of the cornea sometimes can become unhealthy, and this will lead to recurring wound happening, and this can cause a lot of discomfort and pain. Okay, now second, can I have the second slide, please? All right, cataract. Now, of course,
okay.
we will all develop cataract. Please understand, and this is a major disclaimer, cataract is not a disease, it is just an aging process. But diabetics and those who are poorly controlled will have an increased rate of developing it earlier. Okay, now the third slide, please. Okay, glaucoma. I'm sure all of you have heard of glaucoma. You don't have to be a diabetic to develop glaucoma, but when you have diabetes, again, poor control can lead to a risk of developing glaucoma. And basically what that means is destruction of the optic nerve, and you can see on your left side of the screen where it's a healthy orange looking nerve, whereas on the right side it has become all pale. All right, and can we go to the next slide? Okay, so here is where all the main damage happens. This is the retina. This is a picture of the normal retina and refraction. And as you can see here, I have labeled three areas. That is the optic nerve, and then you see the blood vessels, and next to the optic nerve is an area which we call the macula. That is responsible for fine central vision. Diabetes, what happens is it affects these blood vessels, leading to swelling and occlusion, and thereby causing damage on the retina. And can we go to the next slide? Okay, so again, for comparison, on your left, you would see the normal retina, whereas you can see a stark contrast. You can see all these blood patches. Those yellow patches that you see, those are all fluid that has leaked out from swollen vessels. And
so
these,
Dr. John, sorry. So Dr. John, how long does it take from, being from the normal stage to being at the diabetic stage? Like, if you're a diabetic, you have normal eyesight, retina, it looks normal. So how long does it take to go to that stage where, the visual is showing?
well, okay, Sharon, again, it depends on when you were diagnosed with diabetes and how poorly you are controlled. There's not there's no proper time per se, but if you see, again, if I can just quickly bring your attention to the slide, if all this bleeding happens not involving the center, then the patient's vision will still be fine. So the patient will be thinking, I'm fine, I don't have an eye problem. It is when the center is involved and the vision is affected, then only this will tell the patient, hey, I better go and get an eye check. So you will not know, really, you won't know. I have seen patients with even well-controlled diabetes coming with at least a very mild form of diabetic changes in the eye.
I see. Okay. All right. So, Dr. John, just say if the patient is planning to become pregnant, should they have actually a comprehensive eye examination before pregnancy?
No. You don't have to come for a comprehensive eye exam. I'm sorry, you're talking about diabetics who are going to become pregnant, is it?
No, just say a normal normal lady.
No.
Just say because there's a tendency to be to develop diabetes if it's a higher chance when you're pregnant, right? So is it actually advisable for them to come in to have a comprehensive eye check?
What I would say is, if you have a history of diabetes in your family, either your parents or your sibling, you should go for a check. okay, male and female. Then, if you're diagnosed with diabetes, some form of sugar impairment, then please do come for an eye examination. If these risk factors are not there, then if you are going to plan to have a family, no, you don't have to come for an eye examination. Unless, of course, you just want to come and check your power, whether you're short-sighted or long-sighted.
Just to explain what your question asks, I just wanted to highlight the when it relates to pregnancy for those who already have diabetes and they are planning to get pregnant or planning to conceive. What is important is to make sure that their blood glucose is under control. Obviously, if their blood glucose is not controlled, whatever complication that diabetes brings will happen faster, and sometimes it become worse during pregnancy, especially diabetes retinopathy. Therefore, sometimes of our patients, when we treat them, when we see their sugars are out of control, besides screening for diabetes retinopathy, we will tell them to avoid pregnancy for the time when the sugar is still not under control. Okay, because why? The diabetes retinopathy will worsen during pregnancy. Okay, therefore, sometimes we even ask them to go to avoid pregnancy by having contraception when the blood glucose is not adequately controlled. Because diabetes complications is disease of the small vessels and also the large vessels. The small vessels are the vessels that supplies the eyes, the kidneys, and the nerve. For the large vessels are the vessels that supplies the heart and also the brain. Okay, mainly these two vital organs. All right, so for the small vessel complications, what we are seeing more is, besides the eyes, is the kidney leakage, which usually manifests as protein in the urine, and subsequently, if the diabetes is not adequately controlled, it can worsen through the years to as bad as needing dialysis in future. Okay, going back to diabetes retinopathy, I just want to highlight, after 20 years of being type 1 diabetes, the chances of having diabetic retinopathy can be as high as 90%. As if you are type 2 diabetes, your chances in 20 years developing some form of diabetic retinopathy is around 60%. So this percentage is very high. Obviously, if you're planning to get pregnant, we would want you to have a pre-pregnancy screening for diabetic retinopathy. And if you already have some form of severe diabetic retinopathy, sometimes we need to address that by referring quickly to the ophthalmologist before allowing them to get pregnant, because we can foresee during pregnancy things will get worse, right? Especially the sugar control will get worse, a lot of things, especially if they concomitantly have other chronic illnesses like hypertension, if they have dyslipidemia, high cholesterol, this also contributes. For the males, smoking is another contributing factor for diabetic retinopathy development. As you can see that smokers have high risk to get coronary artery disease, heart attacks, and stroke. This is because the disease of the big vessel. The small vessels are like Dr. John has showed, the small vessels that supplies the eyes can be compromised, and therefore some of them needing laser. I have seen type 2 diabetes as young as in their 20s are almost blind. It's just a matter of fact, in terms of statistics, about 9% of diabetic retinopathy end up being blind. All right. So that is, I think it's a very serious condition. We do not want people to be blind at the age when they are supposed to be productive and, starting a family. Therefore, us as an endocrinologist, we are a little bit more aggressive. Obviously, how do we treat or reduce this risk from developing is actually to control their blood glucose, to control their blood pressure. We do not want, so we're not only treating blood glucose, we are also treating their hypertension, we are also bringing down their cholesterol. If they have obesity, obesity is another risk factor for diabetic retinopathy to become worse. And if they are smokers, we try our best to ask them to quit smoking, okay? Because all these complications that I mentioned, heart attacks, strokes, and everything, and diabetic retinopathy, kidney failures, becomes worse when all these coexisting together.
So Dr. John, is there any last words that you would like to share?
No, please just follow what Dr. Shalini said. please go get yourself examined. Even if you're not a diabetic, even if you have no history of diabetes, at least a medical examination once a year is warranted. You know, head to toe, see what's going on. And if you're diabetic, please follow strictly the advice and management given by the doctor.
Thank you so much, Dr. Shalini and Dr. John, for joining us today. I have been
Thank you,
speaking with Dr. Shalini Dharan, consultant endocrinologist, and Dr. John Mathen, consultant ophthalmologist from Pantai Hospital, Kuala Lumpur, on diabetic eye disease. You have been listening to Health and Wellness on BizTech.Asia. For more business and technology conversations, go to www.biztech.asia.